Hi, everyone, and welcome back to the Vagina Healing Podcast. My name is Dakira, and I'm a dietitian that frees women from cycles of chronic vaginal infections. I've healed myself from yeast infections, bacterial vaginosis, mycoplasma, ureaplasma that all lasted a span of 4 years. And I healed myself naturally with no medications, just nutrition and mindset. On today's podcast, I have a very special guest speaker named Dr. Nancy, who is a functional medicine doctor. And after being ignored by traditional doctors for years, her gut and hormonal problems progressed into a hormonal cancer and an autoimmune condition where she woke up one day and couldn't even walk. Functional medicine changed her life, and now she's helped thousands of women to do the same over the last 20 years. And she is rated top doctor of functional medicine and America's Best. Dr. Nancy has reached over 3 million people through her online social platforms and weekly live free masterclasses. So thank you, Nancy, Dr. Nancy, for joining today's podcast episode.
Thanks for having me here. I'm so happy with what you're doing. Your story is so impressive, and it's really something that can pave the way for other women that have been dealing with similar things and maybe suffering in silence. So it's not something that you usually broadcast you're dealing with. So
Yeah.
that's awesome what you've done.
Thank you, thank you. And I was never a kind of person that cared about really hiding like my personal life, like TMI, like for
Mhm.
example, like so that's why I didn't have a problem sharing my history of vaginal infection and stuff because I'm like, okay, it's not like I'm disgusting, it's normal. And if I'm dealing with it, I'm grateful that I at least got to heal it. But there are thousands of women out there who have no idea what to do. They feel stuck.
All
I've
right.
had clients who are stuck in it for 10 years. And so I was like, I feel like I was chosen to heal people from this. So I feel
Mhm.
like it's my mission to help women every single day with this. So I'm glad to have people like you in the podcast who also align with the same mission with helping women to heal naturally so that we can combine our knowledge together and help even more women, which is great.
I love that. It's really nice that you've chosen to be vulnerable and courageous and chosen because I think if we can grow through what we go through, we can come out the other side and now know the way, go the way, then show the way. And that's why we were
Yes.
chosen because you can either suffer through it and just be miserable and depressed, and that is valid. And we're not knocking that because that's a true thing,
Yeah.
that's appropriate response. But if you could then say, well, why is this happening to me? To why is this happening for me? And then to go help
Yes.
others. I think that that's the best way we can really go through what we grow through. And it's great. I love that you've done that.
Yes, thank you. I'm definitely big into alchemizing purposes or alchemizing issues into a purpose.
I agree. It's like that analogy of the diamond where all people have these rocks, but the ones under pressure can become diamonds forever. That's
Exactly.
really a
Yes.
great example. Yeah,
Yes, exactly.
love it.
Okay, so for my audience, I always tell people if you're looking for a holistic approach, you don't want to go to a normal traditional Western medicine doctor because they're trained to diagnose and treat with medications. I always tell my audience, you want to look for a functional practitioner, so either a functional medicine doctor, a naturopathic doctor, or even a functional dietitian. So
Right.
if you want to go ahead and explain what is a functional medicine doctor?
Sure. Functional medicine doctors are taught to be obsessed with the root cause of a problem and not to be obsessed with masking symptoms with medication. So the traditional model is manipulated by big pharma that determines what insurance will cover and then what doctors can do. And a functional medicine doctor won't just keep prescribing antibiotics and antifungals and or ignore the issue and just say it's in your head, which is a very common thing with women's issues. And then you're just perpetuating the problem. A functional doctor will say, hey, let's test your microbiome, which is what the vagina is. It's like the gut, and or your hormones, and or I'm really, really in love with the way you talk about mindset because that's more powerful than any test or food or supplement, in my opinion, as well.
Yes,
The mindset effect, whether you want to call it the placebo effect or the mindset effect, is what I call it. It's up to 80% of the healing. So if we can really recognize that not all functional medicine doctors do this, but the ones in my practice, we really are obsessed with mind, body, spirit. And the functional dietitians that we really collaborate with, they recognize that as well. Because how many of them, I don't know if you know any because you're a dietitian,
I do.
so
Yeah.
they're so stumped by like, oh, it's just what you eat and calories in, calories out. That's it. There's nothing else that matters. There's so much to it. Even just the research behind cooking a meal. versus buying it and the warmth and energy that goes into that. There's so much there with mindset and energy. So that's the biggest difference, if that helps, that we get to the root cause instead of masking symptoms with medication. And then we are holistic. What that means is mind, body, spirit, and natural. We're not into prescribing drugs to mask symptoms. We would use, for example, natural antiseptics is what I call it, like herbs or mindset, like sleep is a great thing for your microbiome, and we often overlook that as
Yes.
young women. Whereas a other doctor, actually I have friends that are OBGYNs and they're stumped. They just keep prescribing antibiotic after antibiotic for BV, for example. And most of them don't even know what mycoplasma is. Never
Yeah,
heard of
yeah,
it, by the way. So
yeah,
hopefully that helps clarify that.
it does. Thank you. So,
Yeah.
can you explain to the audience why traditional medications don't usually work, especially when you're dealing with chronic vaginal infections?
Yeah, the problem's that they'll wipe out all good and bad flora, whether it's yeast, bacteria, whatever the species is. And then I like to compare it to real estate. So imagine if you just knocked all the homes down, and then now the bad bacteria, which will get in, will just take over and put up all these buildings. And then you really have to crowd out, kill those off, but then crowd out the bad with the good. So the missing piece that I find is often overlooked is one, if you just wipe out, you're going to wipe out everything, the good, which help defend you against the bad. And I sometimes compare it to a war, not just a real estate example, but like a battle. And I'm like, the good guys got to win. So we got to crowd out the real estate with the good, get those bad ones out of there, but also we need them to quote win that battle. So I think the biggest thing missing, of course, aside from the mindset, energy, nutrition, all this, is making sure that we're killing off, but also then repopulating. And if we don't do that step, I find that that right there is a piece that's not taught in traditional medical school. I remember talking to a physician friend that's like, oh, probiotics are nonsense. Just go to CVS and get an acidophilus. I was like, oh my gosh, you don't know that is killed off by the stomach acid. That's like one
Yeah,
flora. You need a diversity for a stronger immune system. And
yeah,
that is cheap and got gelatin. No, what was the other ingredient I saw recently? Like safflower oil, cottonseed.
yeah,
Like, why is this in here? It's going to make us worse, right? So
yeah.
it's just an interesting take on that. Isn't a good example.
Yeah, exactly. And I agree on that perspective. And you mentioned before mindset, because mindset for me is huge, because I believe mindset in itself does majority of the work. That's why my clients, I put them on a mindset routine. I
Hmm.
use mindset tools like affirmation tapes that I make on my YouTube channel, or even like subliminals I make on my YouTube channel. So, and I really focus on identity because who you identify with is what you're going to experience in your reality. So when I was dealing with recurring vaginal infections,
Hmm.
yes, in reality, my vaginal microbiome was in balance, like how you described. There was more bad microbes versus the good microbes, but my identity was rooted in I'm a person who struggles with health. Health is hard.
Yeah.
My vagina is honestly just fucked up. I don't know what's
Right.
wrong with it. I'm dealing with all these
Right.
issues. Nothing is working. And I was so heavily immersed and dwelled in that struggle victim mentality of like, why me? Because I never knew anyone else that dealt with chronic vaginal infections. I had one friend who dealt with VV on and off, but like I never knew anyone with this. I'm just like, why the hell is this only happening to me? And so we know that what we focus on grows. So obviously my reality that was exacerbating into these really bad vaginal symptoms.
Mhm.
So I really like how you described how the example you gave where it's like you want to have the good bacteria, but also the bad, but in balance, and then not just knocking off everything completely. Oh, sorry, you had something to say?
No, I was going to say that's the same with mindset. We're not going to be able to likely fully get rid of those negative thoughts sometimes, but we can reprogram and have the positive ones dominate because the negative ones are often automatic. And
Yes,
a lot of people I know in the mindset world talk about stomping the ants, the automatic negative thoughts is what that stands for. And if you could stomp them as they come in, because they're going to come in, but also reprogram them, that really affects your microbiome. There were studies that Joe Dispenza did, Dr. Joe Dispenza, on gratitude. Are you familiar with these?
yes, yes, yes.
And it helps your IgA, which actually is the secret to
Oh
your
yeah.
IgA is actually what your microbiome is made of as a woman, your vagina, the secretions, and it's the same as your gut, your saliva. And when you're grateful, it actually boosts IgA, which helps you not get infections. But then when we're angry, anxious, or fearful, we're suppressing that and then we're more prone to infection. So he just basically just threw some scientific data behind what we know that what you think
Yes.
about, you bring about, what you fear, you attract, right?
Yes.
What you think about and you invite. So I'm all about the affirmations. And that was actually how I also had healed myself because I wasn't yet a functional medicine doctor when I was healing myself. And yeah, I worked with one, but it was the mindset part that really made the biggest difference because you're programming your cells for what to do based on what your mind tells it, just like there's a programming CPU for a computer. So I think that that's really
Yes.
powerful what you said.
Yes. So for those who are not aware, Dr. Joe Dispenza is basically a very famous neuroscientist who studies epigenetics. And back in the early 90s, he was running a marathon and he actually got hit and became paralyzed. And
Mhm.
he reversed his paralysis naturally using his mind. So he's someone who is really great if you want to get more into natural healing using your mind, which is called neuroplasticity. Speaking of Dr. Joe Dispenza, what she's also talking about is the fact that he basically did studies on how gratitude can really heal your body because when you shift from the victim mindset, why me, and just really hating your vagina and really hating your
Mhm.
vagina and your body, your cells are always listening to you. So they're always responding to what you think about it, how you feel about yourself, and your identity. So if your identity and your thoughts around your vagina and around your womb space in general is very negative, like you hate your vagina, you feel
Mhm.
ashamed, you're really dwelling in lots of low vibrational emotions like guilt, shame, apathy, grief, depression. Um, your vagina is not going to want to heal in that state. But if you show it gratitude, this can naturally boost your, as Dr. Nancy said, your secretory IgA, which is basically your immunity. So when you practice gratitude, it can actually boost your vaginal immunity. It can help you to heal. So
Right.
even when you're dealing with recurring vaginal infections, you may feel like, why the hell would I be grateful for this? But you have to realize it's better that you are aware that you have a recurring vaginal infection versus you having asymptomatic BV. Because now, when you want to get pregnant, now you're dealing with infertility or you're having miscarriages because you didn't know
Mhm.
that you had BV. So it's
Right.
best to know and be aware that you are dealing with recurring vaginal infections because your body is telling you something is wrong and that your body wants you to pay attention to it so that you can rebalance it so that you can live a healthy, happy life versus being asymptomatic and then dealing with infertility and miscarriage down the line.
And how many OBGYNs are aware of the connection between the bacterial flora and miscarriage? I don't know any that are.
Yeah,
So
exactly.
you're not against doctors, just to remind us, but they're really there for life-saving medications and pills and procedures. And it's kind of like 911. You know, when you call
Yeah,
911, you're not going to call if you burnt your toast, but you might call if the house is on fire. So they're really the experts of the house being on fire, not the toast burning or, you know, you burnt your dinner. That's what I tell people. They're like the firefighters, right? You wouldn't call them for a
yeah,
little thing. Now, this is a big thing, but for them, it's a little thing compared to the people dying and bleeding to death and getting cancer and all that. This is not a big deal for them, but it is for us. And I think as women, we need to speak up because you were talking with me before about like how it could really affect not only miscarriage, fertility, but also just like intimacy. And that's another thing
yeah,
that I did want to touch on that we didn't talk about. Sometimes your partner actually has a problem, and then that could be the issue. We had some women we've worked with that they joked they're allergic to their partner because they were paranoid of being intimate and having sex because of the fact that their partner, every time they had sex, they would get a yeast infection or BV, depending on the woman. And it actually wasn't even just her, which is totally a thing that she should work on her microbiome mindset. It was her partner, because that also plays a role, just so we could acknowledge that as women, that our
yeah,
partner may need to take ownership and handle some stuff. And it's not just us and something's wrong with us, like we're programmed to think with fertility or BV, that sometimes it's also the partner that might be involved. So, not saying we can't take education and empowerment as women upon ourselves, but I think we have to really remember that there's this whole picture approach, right? When we talk about holistic.
yeah.
I think that's really helpful.
Yes, so I do agree with that. So I often educate women. So I have like two separate perspectives on that. So I do believe that a male partner, yes, can cause recurring vaginal infections depending on their
Mhm.
lifestyle, their
Right.
diet, their
Right.
penile microbiome, all those things. But I also, on the other hand, do believe that the vaginal microbiome is its own immune system.
I
And
agree.
so just as how as with a regular immune system, when your immune system is weakened, you're more prone to getting sick or more cold or viruses and stuff like that. So with your vaginal immunity, if your vaginal microbiome is not strong enough, then you are also more likely to get reoccurring vaginal infections. Um, Even though, like, because with a strong vaginal microbiome, even if
Right.
your partner's microbiome is not in alignment with yours or their hygiene or whatever isn't that great, your vaginal microbiome can still fight off the
I agree.
opportunistic microbes or
Yeah.
even foreign invaders like STDs and STIs. So
Hmm.
it depends on the person and what they have going on. So I do
Right.
agree on both of those perspectives. So, like, at least for me, I always tell women that you shouldn't only be working on yourself. Your partner should also be having a healthy lifestyle. Your partner should be hydrating. Your partner should
Right.
have really great hygiene down there. Your partner should be taking probiotics
Right.
as well, because since you guys can exchange bad microbes, why can't you
Right.
also exchange good microbes?
I agree. You know what's interesting? That example you gave, I really like, because I'm with you that your microbiome should be so awesome that doesn't matter, almost what your
Yeah,
partner's doing, but it's a factor. This is how I used to explain it to people when they're concerned about their immune system and like being in a crowd or going on a plane, especially in recent years. I said, now, I don't recommend you go lick a doorknob or like touch some dog poop and put it in your mouth. Like, sorry to be gross. It's an extreme
yeah,
example. Like, please don't lick a doorknob. Okay. But at the same time, when your immune system is good, you're not worried going on a plane, going in a crowd, going to a party. You're good. Same thing with mold. I know we're now talking about mostly BV, but like mycoplasma, mycotoxins, mold.
yeah,
Yeah, this hotel might be moldy, shouldn't stay in mold, but when your immune system is really good, it can handle that, right? And that's really
yeah,
the goal because you can't control what someone's house or hotel might be like. And then you're going to just have a terrible vacation, right? So it's like, let's get the immune system. I'm with you with the vagina microbiome. Let's get that really good so that you can handle whatever comes at you versus
yeah,
like blaming someone else as well. But I think it's good to consider both, right? I'm more with the
yeah.
terrain theory that you have of your environment and like let's take ownership, but I think it's good to factor that in. But yeah, I'm with you on that one.
Yeah, so even what you just said
Mhm.
ties also back to like your health identity, right? So I feel like as a society, we're so brainwashed to have a poor health identity that people have no choice but to only resort to regular Western medicine doctors because I feel like we're brainwashed to be sick like through the constant pharmaceutical medication commercials or always being told to take medications, doctors being like the holy grail society where like they're basically like a god in society for some
Yep.
reason. Well, not to bash them, but like you know what I'm talking
No,
about.
I know what you
And
mean.
so
I agree with you.
yeah.
Yeah.
So it's like most people don't even realize that they have their own identity around their health. And so, so we know scientifically that if your immune system is strong enough, you can fight off mold, STDs, STIs, all these illnesses. But when your identity to your core is, I am not a healthy person, or I get sick really easily, or I'm very sensitive to things, then even if your immunity is strong, it can be strong. It also can also not be strong because of your identity. And
I agree.
because your mind has to perform confirmation bias to you. So then now you are more likely to get sick and stuff, even though you can naturally have a strong immunity by just your health identity alone.
I'm so glad you bring that up because there's so many cases that are complex that no one can help me, those types of people. And I used to want to prove to them that we could because we've helped complex cases. I was one of them, you were one of them. And then I realized that they have to prove to me before we accept their case that they're actually ready to heal and that
Yeah,
subconsciously they're consciously aware of this subconscious block and they're willing to work through that. Because if I identify this and then they're not willing to recognize this, I won't accept their case because it's just gonna
yeah,
be a mess. It's not worth it. It's just, I mean, everyone's worth it, but I'm gonna basically, it's almost like I'm trying to drag them up the mountain, but they're not gonna climb with me. I'll be your Sherpa, like I'll guide you, but you have to do it. And that's the part that I like about you is that you do the affirmations, the identity, because so many people, whether they're conscious of it or not, there is this identity with their health issue. And it's like, you're not your health issue. You could say, I'm going
yeah,
through BV or I'm experiencing BV, but not, I get recurring BV all the time. I have a BV problem. I am prone to BV problems, like whatever identifying thing you have. Because I think then it just consumes your life. And I think if we could
exactly.
also ask, like, why is this happening? Not just probiotics, health, nutrition, all that. I love all that, but also asking, like, we're big fans of Louise Hay. She changed her diet. She ate super clean, exercise, all these like perfect by the book things. But it wasn't until she did forgiveness with the person that raped her that she stopped getting women's health issues, I should call it. So I
Yeah.
think that we have to recognize that that's often a missing piece that is also overlooked by traditional doctors commonly because it's not taught in medical school. Medical school is really learning how to prescribe drugs. My dad used to call them legal drug dealers, and we're not against doctors, just to remember how smart and amazing and demanding their profession is, but we are against just like a puppet by the book, doing what insurance covers. Like, is insurance doing what's best for our health? Does insurance cover an oil change, a tire rotation, the gas in your car? No, but if you don't get those things, your car is going to blow up or not work. So it's like it doesn't
Yeah.
necessarily dictate what's the best health of our car or of our health. So I think if we could remember that, that would really help us be empowered to not feel like handcuffed to this
Yeah.
system we're a prisoner of, but empowered to rise above it and empower other women to do the same.
Yes, and I 100% agree with all of those things.
Hmm.
So I actually wanted to ask you, so for probiotics,
Hmm.
I explained to women that when it comes to probiotics, number one, you want to look for a vaginal focused probiotic, not just a regular one because of the specific
Okay.
strains, but
Yep.
also probiotics that can actually survive your stomach acid and
Hmm.
not dissolve like gummy probiotics. So can
Yep.
you explain your perspective on probiotics and which are most effective, what are non-effective probiotics, like gummies?
Yeah. Yeah, this is a great example. So you don't want to buy probiotics from CVS, Walgreens, like your local pharmacy. I recommend when you're going to get one, you need one that's enteric encapsulated. So I usually go with third-party tested physician grade dispensaries when getting supplements. So I do use Fullscript, Emerson Ecologics, as well as I work with the company Aptogenics, and I sit on their board to help them just develop things that are going to actually work and don't have any fillers and things like that. So you want to look for something that has enteric encapsulation. Another thing that's good is spore-based probiotics. So Saccharomyces boulardii is one of my favorites because it's a very beneficial yeast that actually crowds out other bad yeasts and it can survive the passageway through the stomach. The other thing I like is I really like all the data that's coming out and using it personally, the Akkermansia.
Yes.
Akkermansia muciniphila is a mucus-loving probiotic. It mimics GLPs, which I know no one's here about GLPs, and I don't prescribe GLPs, but that's a big thing. But it's actually really good for the vagina outside of, not that it can help with weight loss, but outside of mimicking glucagon, which helps you feel full and satisfied. It's mucus loving, which means it's going to produce healthy, slippery mucus. So a lot of times when there's BV or yeast or mycoplasma, it's dry, itchy, irritated,
Yes.
red. And so the mucus, the Akkermansia muciniphila, it actually just helps create a, like in your mouth, there's saliva. There's supposed to be natural cervical mucus that's a little bit acidic, and then these are things that can help. I also really like having diversity. So besides those two, which are like my top two favorites, I love just mixing in a variety of lactobacillus species, Thermophilus, Rhamnosus. And what I would say if you're like, oh my gosh, this is so many big words. I have no idea. She's talking Chinese and I don't speak Chinese. What I'd recommend is that you do not get them over the counter at your local pharmacy. Believe it or not, those are the worst places to get supplements. I usually find the most fillers and junk. Like you said, the gummies don't survive
Yeah.
the stomach acid. I would really make sure you're going to third-party tested, physician-grade dispensaries. So that would be, like I said, like the full script, Aptogenics, but making sure that you're mixing up your probiotics. So the same way that you have to mix up your exercise routine to get
Yes.
results, you do need to mix up your probiotic. I tell women at least once a year, if not maybe once a season, so like once a quarter, you should consider adding in a different and or new probiotic. And I don't want you to just take the same one for 4 years in a row at the same dosage. You can up the dosage and go from one and the next month to two, right? To keep upping that. You can also mix in a second one, then wean off of the one you're on. So the key is diversity because the more
Yeah.
diverse your gut flora is, the better. And I think you know this with food. It's not just probiotics, it's prebiotics. Prebiotics are
Yes.
things like fibers and just foods in general, diversifying those that then makes a more diverse gut, which strengthens your immune system. So I think that if we can remember diversity, don't get the crap at Walgreens, CVS, ShopRite, that has the worst supplements. Whole Foods has some decent ones. I
Okay.
haven't gotten many from Sprouts, to be honest. I know some people love Sprouts. I think Sprouts is great. I don't have too many Sprouts around me, but I think they have some decent ones. If you are an in-person type person, you don't order online, sometimes there's some decent ones. What have you found with brands or places to get supplements?
So I also use Fullscript for my
Yeah.
clients
Yeah, that's what I
because
do.
of the third party testing. So
Right.
for those who are watching, I always attach my Fullscript link down below because with the first order you can get 30% off all your
Yep.
bulk orders, you can get 20% off with my full script storefront. It is a commission-based link, but in
Yep.
exchange, you obviously get that really great discount that you're not going to usually get from the
Exactly.
store. And I prefer for my clients to get supplements from somewhere where I know it's third-party tested and also trusted and also recommended by other healthcare professionals. So
I agree.
I mainly do full script. I
Yep.
do have a free vaginal healing supplement guide that goes over my recommendations for vaginal probiotics and also uses my
Good.
full script link. So if you guys want that free guide, that's also down below. And in that
Great.
guide, I do have S. boulardii in there. I actually don't have Akkermansia. I watched a lecture on Akkermansia in regards to the GI map test and the gut healing, but I didn't know, I didn't think, so I knew Akkermansia was, it promoted like a healthy mucosal lining. I never correlated it with also your vaginal mucosal lining. So that does make sense with
Yep.
Akkermansia. So
Yep.
S. boulardii is always great in
Yep.
general. So I do have that recommendation also in my vaginal supplement guide. But
Mhm.
for probiotics, I always tell people to get it through food and also through specific vaginal probiotics that have strains like L. rhamnosus, L. reuteri, L. crispatus, which is like one of the gold standard strains for
Yep.
preventing recurring vaginal infections.
Yep.
Um, I like the brand, and you can let me know your opinion. My favorite, I think, vaginal probiotic brand is Gyro Formulas.
Yeah, I
I
like
feel
theirs.
like I
Yeah.
have seen major results in my vaginal health from Gyro formulas.
Yeah.
They have a specific six clinical strain one that has L. crispatus in it. So I really like that one. I also
Nice.
like Microbiome Labs vaginal
Yeah, I like
probiotic.
theirs. Theirs are really
Yeah.
strong, but good.
Yes, yeah,
Those are
theirs is
good.
also good.
Yeah.
I've listened to another podcast by someone named Gianna.
Mhm.
I think I forgot what her last name is, but she's basically a vaginal biomedical engineer, and she has her own brand called Meraki Co. And so
Mhm.
I haven't tried her brand, but I
Mhm.
trust in what she does.
Yeah.
Her brand is a little expensive,
Mhm.
but I trust that it's a good quality product.
Right. Right.
And I like for diversity, I like Garden of Life's vaginal
I
probiotic.
like theirs too. I just recommended that this
Yeah.
past week to someone.
Yeah,
Yeah,
even
I
though
like
they
that
don't
one.
have L. crispatus, I also know that the other microbes can like cross feed and exchange and in that they can grow L. crispatus and stuff like that.
Mhm.
So I think those are like the main ones that I really, really like when it comes to vaginal health.
Can I tell you a funny story about vaginal probiotics? It's
Oh
really
yeah.
funny. So when I first started practicing, I had someone that had I now am all virtual, so I'm all online with our sessions. We do them over Zoom. I had a wellness center though, and when I had this before the pandemic, we went virtual, but in the pandemic, we were still in person. I'm not before the pandemic, we were in person. What I meant to say is when I had an in-person wellness center when I first started practicing, there was someone that when she would come in, I was working with her for something else because some women don't talk about it. You know that. So
Yeah,
she
they
didn't
don't.
even
Yeah.
mention it, but I could smell something. And I wasn't bothered. I'm just in healthcare, so I'm thinking I got to bring this up because this is she's having all these bloating issues and inflammation. She can't lose weight, joint pain, thinning hair. That's what she came to us for. But I happened to notice this smell by her between her legs. Like I wasn't there. I'm next to her. It's that bad that I can smell it. And so
Yeah.
I brought it up with her because I'm her provider. So I was just talking to her about it. And she's like, "Yeah, I also get urinary leakage and I have to always wear a pad." And she was just mentioning this. And I said, I think we need to not just do probiotics and things for weight loss and gut health, but this is all related. She didn't think they're related at all. But this is the funny part. So, at the end of the day, I went into full script and I accidentally sent her a vaginal suppository probiotic instead
Yeah.
of the oral. And then she's like, "Yeah, how do I take this?" And I gave her the directions. She's like, "I don't know. It just seems like it's really soft to swallow." And it says here, like, vaginal suppository? Do I put this in my vagina? And then I was like, in my head, oops, but you know what? Actually, yeah, go ahead and do that. That would actually be
Yeah.
great. So, yes, you can take oral probiotics. You don't have to necessarily do a suppository. But how do you feel about those? She actually did really well with them. I just gave someone the other day one as well, but I usually do oral, but every now and then I'll do a vaginal. How do you feel about them?
So I actually love the intravaginal ones.
Yeah.
For me, when I had my last, oh, it's actually been a year since
Uh-huh.
I healed myself from BV actually, which is crazy.
Nice.
So I was able to heal myself in 7 days, and
Hmm.
I one of the main contributing factors was the fact that I used Seed intravaginal probiotic. So
Nice.
intravaginal, guys, just means inside your vagina.
Yep.
So I used Seed because Seed had three different strains of L. crispatus, which I really wanted for like my vaginal immunity.
Yep.
And so, like with my clients, like when they're going through the So I do three phases. I focus first on a detox phase, which is basically just like lymphatic drainage and lymphatic support and just supporting your detox
Hmm.
organs and making
Hmm.
sure that your drainage pathways are open. The
Hmm.
second phase I do is like the killing off phase, and the third
Hmm.
phase is the restoration phase, as you know, because if you kill and don't restore, the problem
Right.
would come back. So
Right.
during the towards the ending of the killing phase and also
Hmm.
during the restoration phase, I usually would recommend two different vaginal probiotics for a month, like orally, and then one intravaginal one for that month. And then after that, then you choose between one of the other oral ones and not both, because I don't want you to end up developing CV, which is the overgrowth of too much good bacteria.
Right.
So I really do, I think they make the biggest difference in the world. Like seeds is really great. My clients have used Evie's. I actually was planning on
Yeah.
ordering some more of Evie's today. If for those who also don't know, Evie is an at-home vaginal microbiome testing company that
Hmm.
checks for over 700 microbes that your normal GYN does not test for. I got to
Hmm.
the root cause of my recurring vaginal infections through Evie. And so I also have a link for Evie down below
Hmm.
to get $20 off of your first order. Right
Hmm.
before this call, I was about to order some probiotics and I realized it was time for the episode. So
Hmm.
I think Evie's intravaginal probiotic is great. I think Seeds is great. I think those are the only two main brands that have it
Hmm.
on the market, but I
Hmm.
100% am a great believer in them and combining it also with the oral vaginal probiotic as well.
I think that's great. Yeah, I know that there's physicians that have prescribed intravaginal suppositories of hormones like estrogen in women, and some of them were kind of young actually. They were in their 30s. It's not that they were 50 years old or 60 per se. And that can even affect the flora. So I don't know if you want to talk about that for a minute, whether you want to comment on it or I'm happy to, the way that hormones can affect your flora, because I think it's really
Yes.
important for us to recognize that it's not like we're in a box with just flora here. It's like everything's interconnected. So,
Yes.
anything you want to comment on it, but I'm happy to also talk about that. I think that's really interesting.
Well, I do. So not that I don't believe in HRT and hormones and stuff
Oh,
like
yeah,
that.
we
I,
don't prescribe that. We don't
yeah.
prescribe that. Yeah, so in
I
case you thought I was
personally,
prescribing it, we don't. We don't
yeah.
prescribe HRT. Yeah,
I personally believe that women's hormones can rebalance themselves naturally through your
I
mind and
agree.
also through herbs and food and nutrition.
I
So
agree.
I always tell women, if you're working with me before trying any hormonal therapies or anything like that, let's just try this approach first because I am so
I agree.
confident in what I do in myself
Right.
that
Right.
I literally believe that I can heal people from anything. Like that's just my own personal
I
belief.
agree with you too. And I didn't want you to think I was recommending prescribing them. I was just
Oh,
talking
no, no, no,
about
no, no.
even just
Yeah.
how, like, I'll use an example, how if we're high stressed, we're going to be high and dry, I call it. So
Yes.
that's where when we're dry, we're actually more prone to an infection. So if we're
Yes.
stressed, we didn't sleep well enough. Sleep is something that really helps your microbiome not be too dry. And that's, you're like, well, what is it? So whatever, I'll use lube. Okay, well, the dryness is a breeding ground for bad bacteria, inflammation,
Yeah.
and all that. Hormones. There's something through the gut called beta glucuronidase, which has to do with
Yes.
estrogen metabolism. And if you have too much estrogen, which is linked to endometriosis and
Yes.
too much testosterone is linked to PCOS. When these things, you can actually manipulate them through your gut, through your diet, through your lifestyle. That will actually help your flora because when there's too much estrogen, we see more yeast. And
Yes.
estrogen can even be high from high cortisol, meaning when you're stressed a lot, it can actually be estrogen going up. And then that's literally pouring gasoline on yeast and telling it to proliferate. So it's really important to recognize that it's not just taking a probiotic and then like sleep is for suckers mindset and eating out whatever you want, tons of caffeine and sugar and no sleep. Those things play a bigger role, I think, as does mindset than just, oh, what supplement should I take? Because I'm a big fan of supplements. I definitely think you should take
Yeah.
suppositories as well as regular oral probiotics for the vaginal health. But I think when we could recognize that other things play a role, same thing with birth control. Birth control is
Yes.
absolutely something linked to more BV, yeast infections, because I'm not a fan of synthetic hormones in you. I'm not a fan of HRT and birth control pills. If you do them, okay, let's talk about what we could do to offset it. We're not judging you. I don't know about you.
Yeah.
I've taken these things, so we didn't know
Yes.
better, right? We just, it's what we were given for any female health problem. Oh, just take a pill to mask your problem. But I think that it's important to recognize that those things make you more prone as well. And there are really natural ways you can help offset the effects of that. Or, like you said, get your hormones balanced naturally with food, herbs, lifestyle, mindset. Big fan of that.
Yes, I'm really glad you actually bought a birth control because I hate. the approach that birth control is
Hmm.
prescribed for, like so many
Hmm.
different things. In the past, I was on birth control when I was
Yeah.
younger.
Hmm.
So I do believe that medications can sort of have it in place. I'm sure you can probably agree sometimes, like for example, when you're in survival mode or you're financially struggling and you can't afford to buy stuff, but
Right.
your insurance covers medications for free. So when I was younger, I was on birth control for many years. I was on birth control for acne. I was on birth control for hidradenitis. I was on
Hmm.
birth control for easier periods at a time where I couldn't really focus on natural healing,
Right.
the finances and also due to stress and stuff. But I am very anti-birth control because, as you mentioned, I don't believe in putting synthetic hormones in your body. I believe birth
Hmm.
control, uh, with my mindset at the time, gave me
Hmm.
PCOS.
Hmm.
Birth control also can deplete a lot of your vitamins and minerals, which are the foundation of your body working perfectly in general. And so when you're depleted in the vitamins and minerals, you're obviously going to start getting health issues and stuff like that. So I'm very against birth control. I believe women can balance their hormones naturally. And I always tell people that birth control is a band-aid solution for things
Right.
that are going on internally. But I can understand if a woman is very overwhelmed in her life and birth
Hmm.
control is just like an easy way out for her at that time. But I always have a mission with my clients to get them off of birth control and to get
Yeah.
them off of medication in general and even hormonal therapies and stuff. So
I agree.
even with what you mentioned about hormones and stuff, like
Mhm.
low estrogen, vaginal dryness, more yeast infections, high estrogen, yeast infections. So like your
Right.
hormones play a very big role. And you
Hmm.
mentioned I forgot what you had mentioned, but when it comes to hormones, I mainly talk to my clients about going to the bathroom every single day because a woman
Yeah.
don't realize is that a lot of your excess hormones, like estrogen,
Right.
are excreted through your waist. And if you're not going to the bathroom
Correct.
every single day, you're having
Hmm.
type 1, type 2 stools,
Right.
you're constipated, you're holding on to excess hormones in your gut, and that
Right.
can be reflected in your vaginal health. So your hormones do
True.
play a role in your
Hmm.
vaginal health, whether you realize it or not. So if you have
Yep.
any hormonal based imbalance or condition, whether that's endometriosis, PCOS, even fibroids, because fibroids are estrogen dominated driven, right?
Correct.
So
Correct.
any of these issues, even if you don't see the link, it's connected somehow, some way because of the hormone. So I'm glad that you
Right.
brought that up.
Yeah, and the thing that's important to remember is that everything's connected. If you think, oh, I didn't think my BV is related to my hormones, or why didn't my OBGYN tell me that my birth control could be causing my BV? It's like, well, they didn't learn that. So before you shoot the
Yeah,
messenger, it's really the fact that Big Pharma just wants you on more and more drugs, not that the yes, it's upsetting sometimes some doctors that brush you off, but honestly, I give doctors a lot of credit. They get less and less time with you because handcuffed by insurance of what they're going to cover, and that's what they can recommend. And then it's just such a mess. You're taught by big pharma's predominant education they get. So we're not totally just bashing the doctors. It's just a messed up system. But I think if we could remember
exactly.
that everything is connected and that yes, if you don't have, I used to go to the bathroom once a week. And I went to all these gastros because I literally looked pregnant all of high school. And they're
Mhm.
all like, yeah, that's normal. I'm like, I don't think it's normal to go to the bathroom once a week, to have a bowel movement once a week. They're
Yeah,
like, well, that's normal for you. And they just gave me laxatives. Now I'm dependent on laxatives. And then I have like painful gas and bloat, but I'm going like once or twice a week. Such a mess. Such a mess. And
yeah,
it's also the toxins. Like think about different toxins that those can irritate your gut. Like glyphosate is Roundup, it's a pesticide. I remember when I used to try to buy organic, my dad's like, oh, don't buy it. It's the same stuff. It's just more expensive. And honestly, that's huge because that acts like an antibiotic, the pesticides, to your gut. And it's like, why don't we look at that? Not just, no offense to taking probiotics, because I'm a fan, you should take them. But it's like, what if we
yeah,
could also eat more organic and ban glyphosate and GMOs that promote histamine? And then there's this, here we go, this histamine, and then there's like itchiness. And it could even be that there's a histamine reaction happening in our microbiome, which is like an allergic type allergy chronic thing, not just a
yeah,
bee or a yeast. It's like that's where we get to that root cause. It's like let's figure this out. And I think if we could try to avoid those toxins and also toxic thoughts, toxic
yes.
people, right? That's another thing that plays a role. So, yeah, a
Yeah.
fan of all that.
So I agree with all that. I love that you mentioned because a lot of people, especially older people, that have like a scarcity mindset. They're like, why are you buying organic? Like it's the same thing, just higher price
Right.
and all those things. But I
Right.
almost an example I learned recently is that when you're eating meats and foods that have antibiotics, you're basically getting a small dose of antibiotics with all of your meals. And so I always tell
Yeah.
clients if it aligns with your budget, I don't want clients to feel like financially forced.
Right.
Aim for organic grass-fed meats. Aim for
Yes.
wild-caught, pasture-raised
Yes.
things because otherwise
Right.
the food quality, your food quality plays a huge difference in
Mhm.
your mind. I mean, in your
It does.
health.
It does.
At the same time, can you eat those things and still be healthy because of your mindset? Absolutely. But if
Of
we're focusing
course.
on a very holistic approach, I would
Right.
tell my clients go for the best quality foods possible.
When
Well,
I was, oh, sorry, go ahead. Keep going.
oh no,
Go ahead.
oh, I wanted to ask because I have so many other questions
Go ahead.
left
Go
to
for
ask
it.
you, and I
Yeah,
don't
go
want
ahead.
to
Go for it.
run out
No,
of
you're
time.
good.
So
Yeah, go for it. Go for it.
more on the topic of the healthcare system and everything, and how it's kind of just like left to keep people in like these issues.
Mhm.
So for you as a functional medicine doctor,
Mhm.
so can you explain how you became a functional medicine doctor? Did you go to med school? Like,
Yeah.
what was the process for you?
Yeah, so I was studying pre-med at Villanova and then went to Jefferson. And then I got trained in functional medicine and integrative medicine. And that's basically getting to the root cause of an issue instead of masking it with meds. And then integrative is like, let's just work together. We're not against doctors. Let's just work with holistic and regular. And then I got more training in functional medicine, herbalism, nutrition. And I'm a really big fan of the lymphatic system, detoxification, mold, learning about that, Lyme disease. These are all sorts of things that people don't talk about. Did training in the pelvic floor, women's health. So I think that ultimately, when you decide what you're going to do, when you've gone through something yourself, you become obsessed with it. And people are like, how did you get so good
Yeah,
at this? It's like, well, I wanted to learn how to help myself and so that I
yeah,
can help others. So I think now when we can help people, we tell them, listen, we're not going to be your primary care doctor that you need to get your annual checkup and look at your heart and all that stuff. That's good. But what we're going to do is look where they don't. Your regular doctor's going to look in this one place for this $10 test, look at your blood. We're going to look the way your mom looks. Growing up, my mom could find anything if we couldn't find it. She just looks everywhere. She doesn't stop till she finds it. That's what
yeah.
we're going to do. And that's the biggest difference is we're just going to work together as a team. They're going to look superficially at you in one place, make sure you're not going to have heart attack, cancer, stroke, diabetes. That's it. Look for those top four things. Great. We're going to make sure we look everywhere to figure out what's going on here and really get optimal health, not do what's normal. You know how you mentioned, oh, yeah, like this is what's normal. Normal means common. So when your
Yes,
results come back normal, it doesn't mean you're actually healthy. It means you're like the average person in your area, and they're not usually very healthy. So we want to remember
yeah.
what we do and what you do is more let's optimize, let's not survive. So I think that's the biggest difference that can help people.
Okay, great. Yeah, so thank you for letting us know. So I want you to explain. So number one, do doctors get nutritional training in med school? And then two, should people be getting nutrition advice from their doctors?
No. So doctors get zero education in med school. If they're lucky, they may get an hour. And I don't even know places that give an hour. This is just a rumor. And you should not get nutrition advice from your doctor. I had a doctor that when I was getting missed periods and I didn't want to do the birth control, he told me to take soy. I don't know your take on that. I don't feel that's the best advice. I remember I had another doctor I just told you said, "Oh, probiotics are a whole bunch of hogwash. Just go get an acidophilus at CVS." And I'm like, "Oh my gosh, that won't even work." So
Yeah.
another one, when I was constipated, my primary care doctor at the time told me to eat a bran muffin. I was like, okay, I'm sorry. I'm sorry. It's really funny because you probably know as a dietitian, a bran muffin, 600 calories, 36 grams of sugar, white
Yeah.
barely has any brand in it at all, if any. There's like
Yeah.
no brand in there. And that did not help. If anything, I got more constipated because it's like white flour constipating me. So it is
Yeah.
topical, but just like I wouldn't ask some guy on the street to prescribe a medication that's going to save someone's life at the ER, you shouldn't ask your doctor for nutrition advice. You have to go to someone that's trained and an expert. And registered dietitians are the experts in nutrition. That's their lane. So I think it's great what you're doing. I think you really need someone that is trained and certified, and it's typically not your doctor. So I would say do not ask your doctor for help. I have a funny story quickly. I know you have to ask me questions. One of my practice members, I work with her whole family, and she's like, "Oh my gosh, I love what you do. I'm gonna go to this med school because they're integrative." She went through the med school. They had 1 hour of alternative medicine training, and it talked about how you should refer to a dietitian, an acupuncturist, a PT, OT speech, a mental health therapist, or a massage therapist. And they did all that in an hour. That was it. That's the only training she got in 8 years of
Yeah.
how to be integrative. That was her integrative program. So do not ask for help on nutrition from your doctor.
Yeah, it's funny because my best friend's cousin, she's currently in med school, and
Hmm.
her mom is a functional medicine doctor. And so with this, my friend's cousin said that she got no training in nutrition at all throughout med
None,
school. And
none.
she loves learning about it. So she talks to her mom about it, she talks to me about it, but she never got any training on it. So I tell people all the time, doctors are not trained to
They're
teach
not.
in nutrition. Like I've had so many crazy stories I've heard from clients literally yesterday. I told you I had a client who told me that she went to a bariatric doctor that put her on a 600 to
I
900
know.
calorie diet, and she's 57 years old. I
That's
try not to
dangerous.
react with my face, but I was like, holy shit, that is not good advice
She's
at
gonna
all.
spike her reverse T3 and go into starvation mode, gain more weight back. I'm
Yep, I
telling
told
you, a
her that.
physician that came to us, she actually prescribed HCG for a living and put people on these 400-calorie diets. She did it, and then guess what happened? The second, third time it stopped working. Why? Because she
Yeah,
split up her thyroid, her body's in starvation mode, she lost all this muscle. And so then we worked with her and had a healthy relationship with food and realized her hormones, her gut health, so many things were off, and she's doing great. And she was also constipated because if you're not eating enough, and then you're too tired to exercise because you're not eating enough. It's this whole mess. Yeah, so that's not
yeah,
that's terrible. But it's common.
yeah.
It's happening
And
today.
I've just seen so many bad advice from doctors. Even
Yeah.
something else I've also noticed that is like related, but also like not on this topic. Like every time I've had a client who has had their gallbladder removed,
Oh
they
yeah.
never got any nutrition
Any
education at all. And
nutrition.
I think
Oh,
that's insane.
I also think it's insane that doctors are taught your appendix and gallbladder you don't need, neither do you need your tonsils. And I am so
Yeah.
against that. And I could go on another whole tangent, but it's mind blowing. Another one that was really good. I remember there was a doctor that my hair was falling out in high school, and he's like, take biotin. It's like the most generic thing you could say. It did not help, as you
Yeah.
probably can guess, because it wasn't even a biotin deficiency problem. It was that I had
Yeah.
hormone and gut issues, and my hair was falling out from those issues. So it's like, what if we could actually find the root cause, not just throw spaghetti at the wall and hope something sticks? And I think that's when you go to someone that's really trained like you, that really knows what you're doing, or as we mentioned, functional medicine, if you need something that's beyond what you're doing. I think or just different than what you're doing. I think it's so great what you do because you specialize. Yes, we've worked with people with BV and we've helped these people, but you're really the specialist in vaginal health. And I think it's so important for women to have someone that's really specialized because your
Yeah.
doctor's not your OB is not either. Sorry,
Yes.
they're not.
Yeah.
Yeah.
Yeah, honestly, I agree because I do follow GYNs and their
Yeah.
advice, like I'm just like, oh, like it's just like
I
not
know.
like
That's
they're
what they're taught, you know?
yeah, I know. And that's the
That's
thing is
sad.
like I have to remember that this is all that they know. So they're just trying to help with what they know. They're not trying to like actually harm people. Like because GYNs don't even know like CB or mycoplasma
No,
uroplasma, not all of them.
no, they don't know
So
those things. No.
yeah, so it is very unfortunate. So okay, so we know that functional medicine is getting to the root cause.
Yep.
Traditional Western medicine is more so diagnosing and treating.
Yep.
So how do you get to the root cause of people's issues?
Yeah. So we do a comprehensive evaluation. The average time that a physician spends with a patient is 7 minutes, and that's generous. It's usually
Very
30
true.
seconds, right? A minute or two. We set aside 90 minutes for the first evaluation on Zoom. We're not looking at your vagina on Zoom. Don't show your lady parts on Zoom. My mom said never show your lady parts on a webcam. We are doing an evaluation, right, of your diet, mindset, emotions, lifestyle supplements. Then we do more in-depth testing because remember, it's not just the testing, it's also looking at their mindset, their beliefs, their traumas. And then we're going to, based on the test results, recommend a particular protocol. So I'll just use an example. We had someone with brain fog, fatigue, weight gain, thinning hair, low libido, and joint pain and couldn't sleep well. I mean, she had a lot of issues, autoimmune conditions. And we worked with her, and besides just recommending, for example, for her thyroid, specific foods like vitamin A rich foods like pumpkin, carrot, for her, sometimes iodine can make your thyroid worse. For her, seaweed would have helped her thyroid issue, but also just speaking her truth. Because the thyroid is near the throat chakra and energy center, whether you believe this or not. And it really a lot of times manifests as I'm not speaking up. And if you don't
Yeah,
want to speak up, you could journal. You could write out what's bothering you. You could burn it. You could put it in a journal. You could tear it up, talk to a therapist. This person needed to speak up for herself, speak how she's feeling, a lot of suppressed feelings. So remember, it's not just getting to the root cause with the testing, such as a urine or stool, or we'll have a mobile phlebotomist, meaning like a mobile nurse, come to your house to draw your blood. Since we work over Zoom, we're going to look at those tests, and that's the definitive way we get to the root cause. But the other parts are, like you said, working on mindset, energy, food supplements, and emotions as well.
Yes. Okay. So I love that you broke all of that down. So can you explain like what are some functional tests that
Sure.
women can do or how can they take it or explain what you do in your practice? Like at least for
Yeah.
me, I mainly do GI map.
Yeah, yeah,
And I
that's good.
also do the epivaginal test. I'm not
Yeah.
necessarily trained in Dutch. I took a course
Okay.
on HTMA, but I
Yeah.
haven't really implemented it. But if you want to explain different tests that
Sure.
are out there so
Yeah.
women are aware.
Yeah, so the predominant tests we use are first we'll do much more in-depth blood work than your regular doctor would do. And that's where a nurse comes to your house, draws your blood, we read the results over Zoom. Then the other one's urine. We'll look at hormones through the urine. And this is important because the blood is inaccurate for hormones. So you have to actually look at how they're being metabolized. So Dutch is just the general word for a dried urine analysis of how the tissues are metabolizing the hormones. It's one of those things that is like saying Kleenex instead of tissue. So it's a hormone metabolite test. So we'll do testing of hormones through the urine. That's much more in depth than blood work and accurate. And then we'll also look at the stool, which is the microbiome. So if we have someone with recurring vaginal issues, we're always doing a stool test. And I know you do GI map. I think that's a good one. We've used that one. Microbiome Labs is a good one. Gut
Yeah.
Zone is really good as well from Vibrant. And we're going to look at that because you have to make sure we're looking really directly at the area. And you could do the vaginal test. I think that's awesome what you do. I think that's really specific. So I think that's really, really helpful. But those are the main tests that we're going to do. And then they tell a lot. They really tell a full picture of, okay, physically, what is it? I'll use an example. Recently, we had this woman with some recurring vaginal issues, and then she didn't want to have sex with her husband, who wanted to have sex with her all the time. And I was like, well, we could have a low grade infection. Turned out she didn't have any infection actually in her vaginal mucosa because she was having symptoms of an infection. She didn't have any infection. She was like dry, red, like irritated, itchy, was having weird stools that were like mucusy all of a sudden. So I'm thinking, okay, let's see if there's an infection. There was no infection. She actually had trouble talking about gallbladder. She has no gallbladder. And she has trouble breaking down fats. So that's why she's dry. That's why her stools had like fat in them. And we got her some HCl, so stomach acid. It's in a pill form, but she also loves lemons and apple cider vinegars. She's going to be taking that
Okay.
in her day, and I'm like, great. As well as avoiding gluten, believe it or not. She was eating gluten. She's like, no, it doesn't affect me. It doesn't affect me. I'm like, well, according to your test, it does, because this
Yeah.
is showing you should not be eating gluten because it's drying you out, causing leaky gut, irritation in your gut, and then you're having these issues. So she made those changes and she's feeling an improvement. We did also recommend a suppository for her. This was more of a lubricant because she didn't I mean, the probiotics won't hurt. I did put her on several oral ones, but it was more that she's dry. So, but a really good one that I like too, if you're just like kind of trying to get one in your kitchen, I like coconut oil. How do you feel about that?
Yes.
I love it.
Yes, that's the only moisturizer I recommend for down there, organic
Yeah,
unrefined coconut
I
oil.
agree. Yeah,
Yeah, I think it's great. It's a great lubricant.
yeah,
Just be mindful, audience, that oil can sometimes break condoms. But
yes.
I think it's really, really great.
Yeah. Yeah, I agree with you. It can break condoms. I tell women just put on a little panty liner and then, keep a designated jar to that area and just put some there. But then, yeah, if you are with a partner, if you're not using a condom, it's great for that, for intimacy, but it's also a great moisturizer. It's antiviral,
Yeah.
antiseptic, works really well. So that's good. Awesome. Did you have any other questions you wanted to ask?
Yeah, so I actually want to ask
I got
one more, well, I think not one more. Okay, but sorry, I'm thinking how to word this. Okay, so actually, so I want to ask just some questions about vaginal infections in general. I want to ask three questions. So I got
Yeah,
these
sure.
questions from my audience members.
Yeah, yeah.
I want to get your perspective on it and also give my perspective on these questions. So
Sure.
the first question that I have that I want my audience to know. So a lot of women deal with vaginal odor, but without a
Mhm.
vaginal infection. So the actual vaginal
Yeah.
skin microbiome can give a really musky odor when they're sweaty or a very
Mhm.
BO-ish odor that people think is BV, but it's not. It's the
Right.
vaginal skin microbiome because it has similar glands as the underarms that also give you that odorous BO kind of smell.
Correct.
So For me, what has worked for me in the past and for my clients is either because I don't recommend soaps down there either, unless you're
Okay.
just it depends if the soap needs to be acidic for the skin. That's what I recommend.
Right.
And only on the skin where the hair doesn't grow. But naturally, I usually would use a tiny bit of ACV and a cup
Yeah.
of water and rinse
Mhm.
that area to get rid of the odor.
Correct.
Or really diluted lime juice. Because when I was
Yeah.
younger, I dealt with really bad underarm BO. My mom's from the Caribbean and she's very
Oh,
naturally
wow.
realistic.
Look at
And so
that. I didn't know that one.
yeah, she made me
Yeah.
use lime as deodorant. So I used that all throughout middle school and high school and worked really well. So I'm
Wow.
like, okay, if the vagina and the underarms have similar
Right.
glands,
Let's do
then why
it.
couldn't lime work down there? So
That makes
I
sense.
taught my clients diluted lime juice
Hmm.
as an astringent, and then like a ACV external wash, not internal, external.
Correct.
And also if you want to use like a very acidic based soap and not an
Correct.
alkaline soap for the skin to get rid of the odor.
Hmm.
Um, what do you recommend for clients that have vaginal skin odor that's not an infection?
Well, I actually recommend a lot of the same things as you. I actually keep apple cider vinegar in my shower. I just used some this
Me too.
morning. Yeah, because actually it's also good for your hair. So it's very good for getting out. I actually have very curly hair. It looks like your hair is like curly, and my hair tends to
Yeah,
be very dry. And so I only wash it like once a week because otherwise it just looks terrible. So I actually used it today to just pour through my head. And then as you know, it just drips down. And it's great for your skin. So some women can't take baths, and I totally get why, but I actually also put it in the bath. So I'll put I learned it from a naturopath. I'll put a cup of apple cider vinegar in the bath, sometimes 2 cups, because it also helps. I used to have eczema, and that's actually linked to a staph infection, which is a
yeah,
bacteria eczema, not just like dry skin or you need a steroid. So I found that it helps down there because it's naturally acidic, which kills off bad flora. So what I do is I like apple cider vinegar, I'll pour it over my head and it just kind of like drips down there in the shower. And then in the bath, I'll put 2 cups in an Epsom salt bath because between the Epsom salts, the magnesium, which is relaxing, and then actually the apple cider vinegar really helps with that flora. The other thing I've done is I'm a big fan of taking baths. I know that when you have an infection, a lot of doctors will say don't take a bath, and I agree
yeah.
with that. But like when you're not dealing with an infection, I actually also put peroxide in the bath. So I'll put a cup or
Okay.
two of peroxide because it's not only that it's antiseptic, but it actually is converting into ozone. And ozone is something that actually is very antiseptic, but in an immune boosting way, where ozone boosts your immune system 400%. So, yes, you can get an ozone machine. We've gotten these for our practice members at home, and they can put ozone up there. It's like a gas, it's made from oxygen, but it's a higher powered oxygen that kills off bad flora. But
Okay.
you just put peroxide in the bath, it actually converts into ozone. And that's another thing that maybe you didn't think of is just putting 1 to 2 cups of peroxide in a bath, like the bathtub. Don't just sit directly in the peroxide. Or
Yeah.
if you are someone that we have people with some really crazy types of infections or cancers. We'll get them an ozone machine at home and they'll put it intravaginally, the ozone, especially if they've had like a cervical, ovarian, or endometrial cancer and or recurring infections, or they just want to boost their immune system in general and they don't have any of those things. It's actually a really great tool that most listeners might not have heard about.
Okay,
Yeah.
cool. So basically have a similar approach. I just never thought of or heard of the ozone part, but
Yeah.
I'm glad that my audience knows that now,
Hmm.
which is great. So now I want to pull up two questions
Hmm.
that I received recently that I also want to answer myself.
Yeah.
Okay. So someone commented on my TikTok last week. I have the symptoms of the vaginal infection, but the swab came back negative. How can this happen? So
Oh, yeah, good. You can comment on that. I hear that all the time. I
yeah,
get that one
so
too
for
all
me,
the time. That was on my
yeah.
webinar last week. Someone asked that. Yeah, you can go. You answer that, and I'll tell you my thought.
So for me, GYNs only test for a handful of microbes. They don't test for
Correct. That's my
everything.
answer. That's it.
Yeah.
That's what I
So
talked
if
about in functional
yeah.
medicine. My mom looks everywhere. You know your mother. I bet she looked everywhere.
Yeah.
You'd find it, right? And it's like
Yeah.
my dad, he looked in one place. Sorry, I just got on my soapbox.
It's okay. But
Good.
exactly. So you can be
Good.
dealing with recurring vaginal infections and have symptoms, and your tests can come
Mhm.
back negative, but it doesn't mean that nothing is wrong. It means that your root cause has not been identified through a normal
Correct.
GYN vaginal
Correct.
swab. That's why I
Right.
tell my clients to work with me, you have to get an EVI test because EVI tests
Right.
for over 700 microbes that your GYN does not
Yeah,
test for. And
that's
so if you're
correct.
dealing with recurring vaginal infections, you're going to your GYN and it's testing negative and they're telling you that you're okay, seek a new GYN or work
Yeah.
with me or work with somebody who can
Yeah.
actually interpret a in-depth, thorough vaginal microbiome test.
I have that question all the time. That's why I started laughing. We had that on our webinar last week. We do free weekly webinars on our website, holisticholinessinstitute.com. And that question actually didn't just get asked last week. I get like three of those questions all the time. It's like three people almost every week ask something about that. Oh, I got a stool test and everything came back negative. It checked for C. diff, which is one
Yeah,
flora. It checked for E. coli. That's great. That's like my dad looking for something and he looked in two spots. Like my mom looks everywhere. Yeah,
yeah,
yeah, that's funny. Yeah, that's exactly what I would say is the answer is that they, whether that's where they're trained to look, number one, and two, that's what insurance covers, number two. It's just, yeah, that's not good enough.
yeah, exactly. And I agree.
Yeah.
Now, the second question, which we kind of briefly touched on, or the
Mm.
third question actually, someone asked, I've been taking olive oregano and black seed oil capsules for a week now or 2 weeks without probiotics, and now I have a heavy yeast infection. So if you want to go ahead and answer.
Yeah, well, I think this sounds like it has to do with what we talked about with we take a similar approach. We do an evaluation and then we focus on detoxification and then we call it reintroduction, but it's basically
Yes,
the same thing you do. I think that you need to take them at different times a day or like you mentioned, kill off, then reinoculate. So my take on that would be consider taking the oregano and black seed oil, for example, before bed and then your probiotic when you get up, or do the oregano, let's say for a couple days, then get in, some probiotics. You just need to separate them by 2 to 3 hours. So same thing with if you're on an antibiotic. If you're on an antibiotic, I know this sounds like a pain, but take your antibiotic. Let's say you took it with breakfast, then at lunch take a probiotic, or before lunch,
yeah,
or before bed take the probiotic, and then before breakfast or with breakfast you're taking antibiotics. So I think if you could separate these antiseptics, which are things that kill off bad flora, whether it's prescription or natural and herbal, by at least 2 to 3 hours from the probiotics, that's great. And if that sounds so crazy, just morning do one and then night do the other. I think that would help.
yeah.
Yeah.
Okay, so I agree. So like you said, so I think what the issue with this person is that she's doing the killing, but she's not doing the restoration. So she's
Yep.
using black seed oil, she's using her oil of oregano to kill things off, but now she's having heavy yeast. Most likely, I don't know this person, so I'm just giving a
Mhm.
general education
Of
answer.
course. Of
Most
course.
likely because she's not restoring the bacteria that's being lost from the oil of oregano and the black seed oil, that now she's experiencing heavy yeast. So ladies, when you're trying to heal yourself, it's not just a matter of killing things off. You have to restore your microbiome with good bacteria so that the imbalance, the severe imbalance, can never happen again.
Exactly. Yep. I would agree with that.
Yeah, so with all of this being said, this is pretty much it for today's podcast episode. I did have some other questions, but it'll
Yeah.
extend our time, so maybe in the future we can do a part two.
Yeah, we
But
could do a
I'm
part two.
very, very, very happy that I had you on this podcast. I think this was very in-depth, very comprehensive, very helpful for many women who are going to be watching or listening to this, whether it's on Spotify, Apple, or YouTube.
Mhm.
So thank you so much for coming on the podcast and answering all these questions and giving your perspective and your insight. Where can people find you, work with you, anything like
Yeah.
that?
Yeah. So our company is Holistic Wholeness Institute. That's WHOLENESS. And you can find us at holistichwholenessinstitute.com. We do a free online live weekly masterclass. We can sign up and I can answer your questions. It's an hour completely free. I do that each week. So jump on our website, holistichwholenessinstitute.com. We also do a lot of posts on social. So on YouTube, you can find us, Holistic Wholeness Institute, on Instagram, Facebook, TikTok. And I post sometimes 10 times a day content of just education, straight up education. We answer your questions. So we're here for you, ladies, and we believe knowledge is power. So do not feel like you have to suffer in silence, that you're not alone. We see you, we hear you, and we can help. So reach out. You're not the only one.
Yes, yes. Thank you. And for those who want to work with me, you can go to my link tree. It's linktree.com/Dakira Horn, which is my full name. It's DeKeirahorne. Whether you want to do a one-to-one call, join my Patreon membership, join the Vag Reset program, purchase an ebook, whatever, it's all in there for you. So yeah. Thank you all for tapping into this episode, and we will see you guys later.
Thank you.